If you have pelvic pain, you are not alone. Doctors say it is a common problem among women. Pelvic pain can be mild or severe. Several issues can cause it, like problems in your reproductive or digestive systems, or maybe just an illness. So in this Ask the Expert segment, Dr. John Baten of Urogynecology Associates explains the pelvic pain causes and some treatment options.
Encompassing anything involving pain in the female pelvis, which is usually between like the belly button and the upper thigh. Now that can be broken down into two larger subcategories. One is acute pelvic pain, where you wake up and all of a sudden you hurt. It's abrupt onset, and that's usually something that's easily identifiable. You go to the doctor and you have like a urinary tract infection, ovarian cyst, or something that can be found pretty easily through imaging or lab test and addressed quickly. Chronic pelvic pain, on the other hand, is pain that persists in the pelvis for greater than 6 months. And this is the one that causes a little bit more problems for people, because a lot of times there's not a real clear diagnosis for it. It's very frustrating for patients, because when they come in, they want you to be able to tell them what's wrong with them right away. And sometimes that requires a little work and effort to actually find what's going on. And a lot of things that are chronic pelvic pain related are really diagnoses of exclusion, meaning you have to rule out everything else before you come up with that as a diagnosis. Again, it can be frustrating for the patients, because sometimes they get told that there's nothing wrong with them, or even worse, sometimes they get told that the pain is all in their head, and that's simply just not the case. With acute pelvic pain, you really find the source of it. I mean, if you have a UTI, you treat your UTI. If you have an ovarian cyst, you treat that cyst, whether birth control, or if you need to go in surgically and drain the cyst. Chronic pelvic pain, there's treatments for it, but because a lot of these things involve multiple different pathways, it involves things like your pelvic floor, your GI tract, your urinary tract. They all kind of get involved, and so it involves treating multiple different areas of the body at the same time to make you get better. For people with pelvic floor or have a component of pelvic floor pain, PT does help. It's usually part of the therapy, usually not all of it. Say somebody has endometriosis, where the lining of the uterus gets out and into the pelvis. So that has to be part of the treatment, but you also have to treat the disease of endometriosis itself.
This Ask the Expert segment on Today at 11 is sponsored by Urogynecology Associates in Flowood.